I'm a GP.
And I'm a GP. PLC.
I'm your traditional GP.
And I'm your possible GP of the future.
I work in your local GP surgery. My partners and I are contracted directly by the NHS to provide healthcare for the local population. Our aim is to provide excellent and safe healthcare in as cost-efficient manner as possible.
I work for an enormous company. They're a household name. They make breakfast cereals, I think. Their ultimate aim is to make a profit.
I've worked here for years. I know your family. I've treated your kids and I've treated you at home.
I don't think we've met before, have we?
I live locally. My kids go to your kids' school and your son captains my son's football team.
I drive 3 hours to get here every day.
On a typical day, I start seeing patients at 8:30 in the morning and finish somewhere between 6 and 7 in the evening, depending on how many patients need to be seen.
I'm paid by the hour.
After morning surgery, I'll go out on visits, seeing unwell housebound patients and nursing home residents. Then, I'll get my clinical and administrative paperwork done in between meetings with reception team, nurses, my partners and outside healthcare professionals. When that's all done, I'll start my afternoon or evening surgery.
I do visits too. No more than 3 though, because that's all I'm paid for. Any more than that, then it's someone else's problem. As for meetings, well, that's why we have middle management.
I often need to do more clinical paperwork at the end of my evening surgery, and I'll often do a visit on my way home.
Traffic's hell if I don't leave spot on time.
When I meet a patient for the first time, it's often the start of a long relationship.
I like to think of seeing patients more as speed dating. Wham, bam, next! I get all the relationship I need from the computer records.
We've all worked hard to meet government-set targets for a variety of health goals. As a result, our practice income has been increased.
I'm employed, and my employer asked me to recommend certain services, which happily the company also provides. I've met certain targets, and they're happy to continue employing me.
I'm a partner in this practice, and as such, everyone in the surgery works for me. They act on my behalf, and the buck stops with me. It's in my interest, therefore, to make sure that they are well trained, that they keep a high morale, and that I look to their welfare.
If someone has a problem, they should speak to their line manager, or the next one, or the one above that. I'm just an employee, here today, gone tomorrow.